So, welcome friends to have a new session of Journey with Dr. Kalathia project. So, this is a session for Repertory Art, something I want to share about my clinical experience about how I use repertory artfully. And in this session, I want to share something that is, we are going to make a lot of mistakes, repetitive mistakes in our repertorization, and their related reason why we are making these mistakes. So it's a very important, you can say, a practical important session today. So in repertory art, you need to develop certain qualities, certain virtues. And first quality, you need to become a master practitioner in repertory. You need to be very precise. And this comes in us day by day. It requires a lot of practice, it requires a lot of exercise, then become precise. And look here the picture. If you throw that arrow and it goes in center in first time, it's impossible. It requires a lot of practice, right? So in repertory also it requires a lot of practice. So suppose in your case, or suppose during whenever you work out, your work is not so precise and you miss something all the time, then do not frustrate, because this is commonly happen to everybody. If you are open to learn and open to understand, then one day you would be so precise, so perfect in repertorization. But try to be perfect as much as you can. This is you have to do. Now, how we are making some silly mistakes, I want to show you. This is an expression I have selected from Rubric exercises, and this is an expression. A case of child of 5-year-old. It's a very normal child. The child is not answering any question, and he is just replying by moving his head up and down like this fashion. So when we are searching for this expression in repertory, we are searching something, many things, and we are making so much mistakes. So first, either our search is similar to the rubric expression, and these are the similar expressions, similar rubrics from the repertory, like answers monosyllabic. So this is similar, like person reply yes or no. So we pick up that word yes and no from the expression, and we find out the rubric for yes and no. But what is the meaning of monosyllabic? Mono means single, syllabic means word. So any person gives answer in single word, yes, no, okay, right, perfect, then you can select monosyllabic rubric. So this is we are going to make a common mistake. We think similar. Another answer is answering answers monosyllabic, no to all questions, or yes. So monosyllabic is there, but always answering no and yes. So here written expression has no and yes, so we select this rubric. Now this is a very dangerous thing we are doing in our repertory work, is interpretation. Forcefully we are trying to understand the person's expression according to our own reasoning. This is we call interpretation. Like a person is not in this expression, person is not able to give answer or giving answer in this fashion. So what we see, like person is very taciturn, indisposed to talk. He or she do not want to talk. So this is taciturn. But this is our interpretation. We don't know why he is giving this or that. He might be shy, he might be cowardice, he might be taciturn, he don't want to answer anything. But we do not have to apply our mind here. Right? Whatever is there in case, we have to look exact in repertory. That's all. This is our only duty. We do not have to apply our mind. But we are applying in our mind in our cases. Another expression is introverted. We think like person is very reserved or introverted and that's why he is not giving answer and that's why he is moving his head. Conversation aversion to. He don't want to converse and that's why he is moving his head. Quiet wants to be. He do not want to talk. He want to be quiet all the time. Answer indifference. He is indifferent to answer. Or either he might have physical problem because ultimately we are doctor. So we think he might be has the problem of speech. He is not able to speak out and that's why mind aphasia or wanting speech and voice wanting or lost. This is basically. So this way we are interpreting rubrics. This is not true. Now suppose we have to look for the reason of why we are interpreting, then there are 3-4 reasons. First is, we might be very smart, but I frankly say you, smartness is not working in homeopathy. As Dr. Sankaran always say, you need to be very stupid. As much you are stupid, your practice will work more. It's not true. You need to be intelligent, but you need to know where to apply mind and where you don't. This is you have to learn. This is one reason. Another reason is we don't know exact thing and that's why we are searching or we are finding here and there or thinking this and that because we don't know. And for this reason you have to refer repertory every day. Few rubrics you have to learn every day. You need to work on cases, many cases, then after you know the repertory thoroughly and then after whatever patient gives you expression, you are able to turn out them in rubric. Another thing, either you are conceptualizing a lot in repertory. You are applying a lot of theories like especially I give you example, you are a mind method practitioner like a Segal method and then you interpret like person has expressed this, so person light desire or many things you can, many rubrics you interpret and think. So this is not like I am against of Segal method or mind rubric method. I even like it, but it has a special understanding of each rubric. So you have to understand them rather to jump over and think so prematurely. So this is the reason to have our interpretation. But whatever way, this is one example. Main important or main learning here is you do not have to interpret anything. Every single information should be coming from the patient, not from us. I remember one case from Dr. Sankaran. He has a case, and the case has, it's a short case. Case has the lady, 30-40-year-old, and recently, just within 1 or 2 months, her husband died. So he take all that rubric like element from shock, grief and all, and he gives echinacea, but it hardly works. Lady has some gastric problem or headache or something. I forget the complaint, but then after, lady come after 1 or 2 months or follow up. Second time also he changed the potency and all, and then he decided to take a history again. So in retake, lady says, since my husband died, I have this headache. Especially, I forget the complaint, but just take the headache. And he suddenly realized, like, why have to take a grief? Because in general situation, when your husband or wife die, you feel grief, and that's why he take the grief. Then he asked the question, what do you feel when your husband die? And few minutes a lady stare on Sankaran, and then she say, I am so happy. So he get die, I go away. And finally he had taken the rubric element from joy and kufia given, and it worked. So this might be happen. Everything should be coming from the patient. You need to be unprejudiced ultimately. This is a real unprejudiced. So this is our main enemy in our entire repertory work. Interpretation. It should be there. And this is our first hindrance to not be so precise. Let's see another. Something added from your pocket. It's actually more than interpretation. Interpretation is also we are putting something from our side, right? But this is more even than, because you are diverting the understanding. Let's see. Anger, answer when (2). Now you just don't know anything. When you give this kind of things or choose this kind of rubric, then what it indicates? You don't know anything about repertory. Then only you make these grave mistakes, because you need to be as exact as you can. But here you don't know. Like person is not answering because when somebody says them, don't answer. At that time person is answering. This is the meaning of this rubric. Person answer when (2). उसको बोलेंगे कि आपको बोलना नहीं है, उसी टाइम बोलेंगे. The person is talking when implicitly somebody say him to don't talk. It has no correlation with this expression, right? So this way we are putting something so many things that is not really at all there in the case. Another thing is spoken to, aversion to, being. Look very similar, right? Spoken to, aversion to, being. What does it mean? He don't like somebody spoke them, somebody say them, like do this, do that, don't do that. That way. And you see here Brahania is the main medicine because they don't like that kind of disturbances. Chamomilla. So this is something added from our pocket. And many cases we are so many things we are adding from our pocket. Here the precise rubric is answering nodes by. Nodes mean moving your head. Very simple. But because we don't know exact rubric, we are searching everywhere and feel like this might be there, this might be there, this might be there. So this precision is very important, not only in mind symptoms but always in all kind of symptoms. The exactness is required in repertory. Now let's see few general tips. Avoid too much general. Like anybody asks you question, where is India, and you show them the map of the world. Of course India is in the world, right? It's not on the moon or on the Mars. It's on the world. But you need to be something specific, not exactly you have to look. A very general kind of thing. So this has happened in our cases also when we are taking so general rubric. And that's why many times I say, like you have to select a rubric which has not so less remedy and so big number of remedies. Let's see example of two general rubrics. Head pain, headache. So any person has just headache and you take the rubric directly. Actually in this kind of cases you have to inquire and you have to find out the symptoms. You have to make the symptom complete. Headache, modality, side of the headache, type of the headache, concomitants. But you are not putting emphasis and just put this very general rubric. Another mind, restlessness. It's a very sure symptom. It might be very sure symptom in case, but it's too general. 859 medicines incomplete. Another thing is generality weakness. Another rubric is irritability from mind. So these are examples. Now I have also one question. We easily understand, like if you are taking so big rubric, it has no meaning in repertorization, right? But here I have question. Suppose your case has only too much general symptoms, only. Whatever putting your emphasis on case taking, person do not able to go deep and person don't know, or even case has not so clear symptoms, then you have to select anyway these general symptoms. Then what to do? Hope you also have suggestions, many suggestions. But I want to say, if this kind of situation arise in the case, then you have to select a repertory which has general symptoms with small number of remedies in that symptom. Let's see. Select such a repertory which has listed small amount of medicine, which is very sure medicine, experimented medicine in that general symptom. For example, a Phatak repertory. So select Phatak repertory in such kind of symptoms. Now same way, avoid too much specific symptom. How? I will make you understand. So question is, you do not have to select that single remedy rubrics. Generally when we study other doctors or other teachers seminars and or videos or whatever it is, articles, they put so much emphasis on selection of that single rubric, single medicine rubrics. Then why we have to avoid that too much specific rubric? Let's see. These are the examples. Vertigo, morning, headache after. Only one medicine. Eye muscle, ciliary left. Eye muscle has affection, especially left side. So these are single remedy rubrics. So now what is the solution? Because many teachers say you have to select them. And here I am saying no, do not select them. Then what to do? Let's see. Select them with caution. Need to be very careful. How to select? First, you need to confirm them. Like this is the rubric, this is the symptom. If it is 100% sure symptom, then select them. And one more thing, as we discussed many times, that symptom should be part of the totality. If it is not covered by the totality, other medicines, then forget it. Or either try to find out that medicine has all symptoms, either in Materia Medica or proving also. If it is not there in repertory, then search in Materia and proving. But it should be there, all the symptoms. Because in homeopathy, we are not selecting medicine on single symptom. We need at least minimum 3 symptoms, which is very sure. Then only we are able to decide the medicine. One symptom never allow them to sit on driver's seat. If you are so sure like it's a very peculiar symptom, then start your journey from them and confirm from the rest of the information. This confirmation is very important. So this way you can select that common symptom, that very peculiar and single remedy rubric symptom, but with very much care. You need to be very much careful. First confirm 100% and then select. But it is not happening in each and every case, right? So each and every case, if you are selecting a very few medicine symptom, then you need to be sure for it. So as the lesser the medicine in the rubric, you need to be so sure about it. Otherwise don't select it. So this is the learning I want to share in this talk. If you have any question or queries, then share in our group. We'll discuss together, right? So it's a happy journey. Thank you so much, friends.